Why am I shaking? It feels like my muscles are twitching.
Yeah, hey, do you want to go to the mall today? Sorry, yeah, that sounds good.
Why aren't my words coming out the way I want them to? Maybe I just need a drink. It feels like I'm choking when I swallow.
Hi there, Christine. How are you?
I'm good, how are you?
My name is Jill. I'm going to be your nurse today.
Hey, Jill.
Just have a few questions for you.
Okay.
I'm just wondering what brought you in today.
It's been going on for a while now, but my hands, they feel like they shake.
Okay.
And, I don't feel right. I feel like I am having a hard time swallowing and even eating. Sometimes it feels like it's hard to do. And just even walking. That's the reason why I'm here today. I fell. I don't know what happened. I felt like I stumbled over myself, and I'm just very tired. So I just want to find out what's going on.
Okay. Do these symptoms happen? When do they happen?
Just kind of, just whenever. I don't feel like there's anything that brings it on per se. It just feels like it's just whenever.
Okay. Is the numbness and tingling or cramping, is it worse in one hand or one arm?
I really notice it in my right.
Okay.
My right arm. It just, kind of, my whole arm, it feels like it cramps and the muscles kind of spasm.
Okay. Do you notice, does anything exacerbate the symptoms?
Not really.
Okay.
It's somewhat, like I said, it just feels like it just could be any time of day. It just happens. It just feels like the cramping and the tingling and all that.
Okay. Now, when you say it's been going on for a while now, about how long has this been going on?
If I can think back, it's been about 8 months now.
About 8 months, okay. Was there anything going on in your life at this time when the symptoms started?
Pretty much just, I'm retired, so I just kind of have a normal everyday routine.
Okay.
And I just started noticing it when I was, like, if I put my makeup on, my hands shake, or if I'm doing my hair, I've been noticing that my right hand shakes a lot.
Okay.
So just doing things, washing dishes, I feel like just the cramping gets
Okay.
real bad.
How is this affecting your daily life?
Oh, sorry. I don't really know why I did that.
That's okay.
I don't know. Sorry.
You're not-
I'm just
okay.
confused. But
That's okay.
so anyway, I just feel like I just not myself. Like I said, I'm tired and I just feel weak,
Okay.
and it's affecting the way I can do things, and then of course what I just did there, that was, I don't know why.
Does that happen
I did that.
often?
It does happen every now and I can't control myself.
Okay.
I
Okay.
don't know. Sorry about that.
That's okay. You don't have to apologize. All right, I'm going to do a few tests in a minute. I'm going to just listen to your heart and
Okay.
your lungs. You take a few deep breaths for me. Okay. And again. And again. And again. And again. And again. All right, I'm just going to listen now. Okay. I'm going to take your blood pressure too a second. texture is good. It was 110/70.
Pretty good.
Is that about where you usually run?
Yeah.
Okay. Just gonna get a temperature on you in 2 seconds. All right, and your temperature was normal.
Thank you.
Can you squeeze my hands for me, Luna? All right. Okay. Now I want you to lift up and touch my hand. Okay. And your other arm.
I feel like I can't go any further.
Okay. Is that painful?
It's not painful. I just feel like, almost feels like something is just almost pushing down on my arm.
Okay.
I just can't get any.
Okay.
Yeah.
Okay. But no pain.
It doesn't feel painful.
Okay. All right. I'm gonna go talk to the doctor.
Okay.
Your doctor today is gonna be Dr. Miller.
Okay.
And we'll both be back
Okay.
shortly. Okay.
Okay.
All right.
Thank you.
Hey there, Dr. Miller.
Hi.
Hi. We have Christina here who came in. She just had a fall today. She's a 68-year-old female. Has just been recently complaining about some muscle twitching and cramping, and also just weakness in her right hand more significantly than the left, but she's also having some in her left. She's saying that she's having a hard time swallowing and feels like sometimes she feels like she's going to choke when she's eating.
How were her lung sounds? Were they
Her lung
clear?
signs were all clear, yep. So I don't, I don't feel like she has aspirated, but I do feel like
One side was weaker than the other, or both weak with your assessment?
the right hand was definitely weaker. She did have like some inappropriate laughter too,
Okay.
that I noticed. All of her vital signs were within normal limits.
Neurochecks? Good?
All normal,
Okay.
yeah.
All right.
All right.
Did she complain of any difficulty breathing? Any
No.
like tingling numbness?
No.
Okay. All right. Well, I'll go check on her and see what's going on.
Sounds good.
Thank you.
Yep.
Hi, Christina.
Hi.
Hi, I'm Dr. Miller. Nice to meet you.
Nice to meet
So
you.
I'm hearing that you're having a bit of muscle weakness.
That's right.
Okay, can you explain to me when that happened?
Well, I told the nurse it's been about 8 months.
Okay. And it's progressively getting worse, you would say?
I would say
Okay.
it does feel like it's, coming on a little more than it was, and
Okay.
I definitely feel more tired than I did, I guess, when I first started.
Okay. And have you been exposed to any heavy metals lately? Lead paint, mercury?
No, not that I can think of.
All right. Do you have any other symptoms that you didn't mention? Because I heard that you were dropping things or doing your makeup a little shaky.
Yeah. I guess I kind of have been having a harder time going to the bathroom.
Oh yeah.
Yeah,
Constipation.
Yeah,
Okay.
I'm usually pretty regular.
Okay.
But lately not so much.
And when was your last bowel movement?
Probably like 4 or 5 days ago.
Okay. Look into that. Are you drinking enough water, or is it because it's difficult for you to swallow that you're trying to?
A lot. It is. It's difficult for me to swallow.
Okay, and eating, you're probably
Yeah.
not getting adequate nutrition right now if you're
it's-
scared of choking.
Yeah, it's really scary.
Okay. All right, and then how about your daily life, your quality of life? Are you still participating in activities that you used to?
Probably not as much as I used to.
Okay, I did hear that you were pretty exhausted.
Yep, I'm really tired. I really just want to stay home and just kind of sit on the couch, watch TV, sleep, take a nap.
Would you be interested in doing any therapy or counseling to talk about that?
Sure. Yeah, if there's some
Figure
other
out-
ways that can help me.
Okay. And we're probably going to run a few tests, Christina.
Okay.
I'm thinking that we're going to do an electromyography test, which
Okay.
is going to assess your nerve and muscle health and
Okay.
the cells that control that to see where that's at.
Okay.
And then we're also going to do a nerve conduction velocity test, which
Okay.
will test the impulses of your nerves.
Okay.
See how they're working.
Okay.
And then we're going to do an MRI on you just to rule out anything else. Your symptoms are pretty broad.
Okay.
So it could mean a lot of things.
Okay.
It could mean
So
nothing.
you don't really
We're
have
Nope,
an
we
idea?
don't really know. After we
Okay.
get these tests, we'll figure it out and we'll
Okay.
we'll try to consult with you then. After we'll schedule a follow. All right, Christina. We're also going to do a blood and urine test on you to look for.
Okay.
You know, is it all right if we're going to test for you to see if you're HIV positive? So
Sure.
that can cause some of these symptoms.
Okay. Yeah.
We're going to check your B12 and folate along with your thyroid, parathyroid,
Okay.
and see if there's any genetic links between any disease that's out there, all right? And
Okay.
then one last thing before I head on my way and
Okay.
send you off to get those tests done. Can I
Okay.
check in your eyes real quick?
Sure.
All right, look at me. Okay. Perfect. And can you follow this? I'm just doing this because I did hear that you've been having some inappropriate laughter. And we're just going to make sure it's nothing wrong with your brain, okay?
Okay.
Well, it was nice to meet you.
Nice meeting you.
And I'll see you soon.
Okay. Thank you.
Okay, yeah. All right, well, I'll let her know. Thank you.
Hi, Matt.
Hi.
Hi there.
Hi, I wanted to talk to you about
Sure.
Christina, our patient with the muscle weakness.
Okay.
Well, I called Dr. Johnson and then I wanted a second opinion because her results are indicating that it could be ALS.
Okay.
Her labs were all normal. And her EMG and nerve conduction tests were diminished.
Okay.
And since there's no real diagnosis that's strict to the point, I wanted to get a second opinion, and he believes that my information is my suggested diagnosis is
Okay.
correct. So
Okay.
we're going to continue on with treatment. So I'm going to bring her in here, and we're going to get together, me, you, and the caseworker, social work, and discuss our options. So
Okay. Thank you.
you're welcome. Thank you. Hi, Christina. How you been?
Doing okay.
Yeah. How's your muscle weakness? Done.
Still about the same. Just feeling real fatigued, real tired.
Okay. All right. Well, we got your results back,
Okay.
and the EMG, the nerve conduction test, are diminished.
Okay.
And then we also got your lab results back, and all of those were normal.
Okay.
So I consulted with another physician,
Okay.
and he went over your results, and he and I both agree that we are believing that you have ALS, which
Okay.
is also known as Lou Gehrig's disease.
Okay.
It's a rapid progressive disease,
Okay.
and there's no cure for it.
Okay.
It attacks your nerve cells that are responsible for controlling voluntary muscles, such as your arms and your legs
Okay.
and your face. And that's why those tests were diminished.
Okay.
Okay. The upper and lower motor neurons stop sending signals over time. So eventually you will go into respiratory failure.
What
So
does that mean?
that means you will stop, your muscles won't be there to help you breathe. So we might have to put you on a ventilator.
Okay.
So we have a medication that I'm gonna prescribe to you to help slow down
Okay.
that process so that we don't get there yet. There's only one medication right now for ALS, and it's Riluzole, and we're gonna give that to you twice a day, 50 milligrams, and we want you to take that on an empty stomach, 1 to 2 hours before meals, preferably.
Okay.
And it's harder in the mornings, just in the morning on an empty stomach, okay? And then this is shown to slow down the progression.
Okay.
And we also have baclofen, which is a muscle relaxer and an antispasmodic, which will help with your twitches
Okay.
and your uncontrollable movements. But we don't want you to be driving. Do you have any support at home?
Well, my daughter does live with me.
Okay.
So.
And can she drive?
Yep.
She can drive. Would she be willing to help us, like help you out with?
I think, yeah, when she finds out what's going on, I think she'll be more, she'll step up to the plate.
Okay, because with that medication, it also is going to cause side effects such as drowsiness and dizziness.
So I'm even
And
more
we just want
tired.
you to be careful because you have fallen.
Mhm.
So we're going to be monitoring your kidneys and your liver with these medications
Okay.
because the Riluzole, the one to help with the muscle degeneration, is going to to affect your liver.
Okay.
So we don't want you to be drinking.
Okay.
Sorry if that's a problem.
That shouldn't be an issue.
All right, good. Okay, do you have any questions?
I'm just kind of taking it in right now. I'm honestly a little shocked.
Yeah.
A lot shocked.
All right, we're gonna actually meet up with the nurse and a social worker,
Okay.
and we're going to discuss our options and
Okay.
talk about your sport. So we'll work with that, okay?
Okay.
Well, I'll see you soon.
Okay.
Nice to see you again.
Me too. Thank you.
Hi there, Christine.
Hi.
I'm Jill the nurse,
Hi,
and
Jill.
I brought in Rachel,
Hi.
the social worker.
Nice to meet you.
I hear you received some news about your diagnosis. And we need to talk about a lot of the concerns that come along with this diagnosis to make sure that we can avoid some of the complications that arise from the muscle deterioration.
Okay.
Okay, so we're going to talk about a few things and recommendations, and then I know Rachel has some information about some support groups as well as some therapies that we're going to have come into the home for you.
Okay. That sounds good.
One of the biggest concerns with a diagnosis like ALS is nutrition concerns. I know you had said that you're having a hard time sometimes with swallowing because of the you feel like you're choking. You had also mentioned that you just kind of feel weak, that your words don't come out the way that they should. That is it's a concern because we want to make sure that when you're having difficulty swallowing and having those muscle spasms, you may be apt to not eat as well as you should be. Some recommendations for that, and we are going to have a speech therapist come in and evaluate you, because a lot of times when your swallow reflex is not as good as it should be, you may get some fluids down into your lungs, and we don't want you to get pneumonia. And we also need to look at making sure that you're getting enough calories. A dietitian, we're going to make sure a dietitian is on board and also meet with you and come up with some ways to increase your calories so that we can maintain your weight. Another concern that you had was the constipation, and that is definitely a concern of ours too, because that could mean that you're not getting enough fluids in. And that's an area after the speech therapist evaluates you and does the swallow study and finds that it's safe for you to drink water. If she recommends that we thicken water, do you know have you ever had any experience or?
I have not.
Okay.
I don't know how it works.
Okay. There are some powders that you can add to liquids that will thicken it so that you don't cough and choke on those fluids, and we can prevent you from getting pneumonia. And then that will also help, if we can get those fluids in, will help prevent constipation and also causing dehydration. Does that make sense?
Yes, it does.
Okay. Another area of concern, and I know Dr. Miller had mentioned the respiratory concerns with ALS. We are going to have a respiratory therapist come and evaluate your do like a baseline respiratory evaluation just to make sure you're breathing okay and getting the levels of oxygen that you should be. So that's another appointment that we're going to set up. I know you're going to be busy with appointments. And Rachel's going to talk. She has looked up some other therapies that we're going to have involved with your care.
All right, Christina, we're going to get you involved in some physical therapy. This can help address pain, walking, mobility, and any equipment needs at home that you might need help with.
Okay.
This will maintain your independence and better quality of life.
Okay.
We're also going to do occupational therapy, and this can help compensate for your hand and arm weakness that you have.
Okay.
This will also help maintain your independence. There's not much. Okay, Christina, we're also going to make appointments with me in the future.
Okay.
We want to keep a social worker around to help you with any financial issues or insurance issues that you might have. I'm also going to leave you with this paper.
Okay.
This is has all kinds of information about support groups.
Okay.
The ALS Association offers different chapters in states for a support group in your area. And the closest one to here would be this Grand Rapids support group.
Okay.
Also, Spectrum Health in Grand Rapids offers different, less formal support groups. Like they go have coffee together
Oh, okay. That'd be nice.
once every couple months, and the dates and locations are on this website for you.
Okay. Thank you.
Do you have any other questions right now?
Just trying to get through.
I know it's a lot to take
It's
in.
a lot to take in.
It is a lot to take in. And we're here to support you. And if you ever have any questions, like I said, the next few weeks are going to be busy with a lot of therapy appointments and getting used to this new way of life. But we're here to support you, and you can call whenever you have any questions.
Okay. Well, thank you.
You're welcome.
And you
Beep!
nominated me.
And today.
Well, why are you laughing?
Hi, Christina. Good to see you again.
Oh.
How you doing?
Okay.
All right. Tests showed that they are diminished.
Okay.
So that can